When Dr. George Bisset arrived at Texas Children's Hospital in 2010, he wanted to create a primary reading space that could incorporate every pediatric radiology subspecialty.
When I arrived here 5 years ago, one of the things that I encountered pretty quickly was the fact that our reading rooms were very fragmented. We had reading rooms in multiple buildings, and each reading room had 2 or 3 workstations in it. And when an interesting case came up, if it came up in neuroradiology, basically what would happen is the neuroradiologist would talk to the resident or fellow on the neuroradiology rotation, and they would be the only ones that would be able to take advantage of this great case. One of the things that became fairly apparent to me from the very beginning was that we needed to have what I would consider a Grand Ballroom concept of a reading room where we could have everybody in one place. I thought it would enhance the camaraderie, enhance the esprit de corps, enhance our ability to collaborate from a teaching perspective as well as from a research perspective.
In some ways, penny wise and pound foolish to look at the flow upstream of everything that flows through your imaging modalities or your imaging centers. You have to consider the downstream where all that data, all those studies are going to flow into a reading room. And at the end of the day, the product is your interpretive report.
I think one of the things that we considered as we were talking about this Grand Ballroom concept for our reading room is, what's the value proposition? How do we provide a quality experience for the patients? So what I saw is that our oncologists, for example, would end up going to one reading room to find out the results of the bone scan, then they'd have to go to another reading room to find out the results of the chest CT looking for lung metastases, and then they'd have to go to an additional reading room to find out about the MR of the brain. So I thought we could gain efficiencies if we could put everybody in one location so it becomes one-stop shopping for the clinicians. So what we ended up doing was we looked around and tried to decide who would partner with us in helping to plan out this reading room. We have lots of architects here at Texas Children's Hospital. We have lots of engineers, but what we really didn't have was that group of people who really understood all the nuances of the reading room, what we really needed. We didn't want to just build a box and then put workstations in it. We really wanted to partner with somebody who could help us plan the entire location within our facility. So we presented Patrick from RedRick with a box and asked him to partner with us to create a reading room that would be the reading room of the future. With their experience, we thought it would give us the best chance at creating an outstanding work environment for our radiologists. What creating the Grand Ballroom concept has done for us is that it's allowed the radiologist in that ballroom to actually focus on interpreting the radiographic studies without as many interruptions, whereas the radiologists that we're putting in the other locations tend to serve a role more as a consultant. One of the other tremendous benefits of having most of the radiologists in one location is that we've gained some efficiencies with regard to coverage, but what it's allowed us to do is we have every morning at 9 a.m. we have a daily quality huddle. Probably 6 months ago, we had them over in the MR suite, and we were lucky if we had 2 or 3 people attend because everybody was too busy in their specific area. But now that we've got all of the radiologists in one location, we find like we have that daily huddle immediately outside the Grand Ballroom. And they come out and they attend the huddle. And now we have probably 30 people, 25 to 30 people every day at this huddle so that everybody's on the same page. I think the value proposition is that it becomes more efficient for us as radiologists. I think our workflow is more efficient. I think The environment is certainly more conducive to teaching. I would tell you that from the perspective of the clinicians, and again, the experience is somewhat preliminary, but the feedback has been excellent.